Commonest problem with brain tumor because of the growing mass inside the skull is headache. So this is very common in adults and late adulthood, and even in children who are older than say 5 to 10 years of age. In young children, it may be increasing head size or head circumference because the tumor is growing and the skull bones have not yet fused. Now this headache tends to be early in the morning headaches. It may be very severe with vomiting, and it gets worse day by day. Suddenly people will get worried all headaches may be related to brain tumor. It's not so. There are so many reasons of headache. If the headache comes routinely, regularly, and it is the same intensity over a period of time, it could have so many other reasons, from stress to hypoglycemia or even migrainous headaches, etc. But if the headache is becoming severe day by day and is associated with vomiting which relieves the headache, and especially it's more common in the morning, with or without blurring of vision, this headache has to be taken seriously and one should attend a doctor's consult. Other than headache, there could be other issues like a seizure. Patient can get fits. That could be a sign of something getting irritated within the brain. Again, fits are very common up to 25 years of age. We call them idiopathic, no specific reason. But in the adult age group, if somebody gets fits, then one should look for other reasons other than it being idiopathic. Means there could be some reason for the seizure. It could be also a tumor. So one should get a scan and check out whether there is a tumor related to this. Apart from these two symptoms, one can have loss of the function of a particular part of the body depending upon where the tumor is arising. If it is arising near a particular nerve and pressing on it, that function of that nerve may be lost. Like for example, loss of vision or loss of hearing, loss of ability to swallow, inability to move say one side of the face, or inability to move the eye producing double vision, or hand or leg weakness, or any part of the sensation in the body decreasing.